Well, hi. I want to talk to you a little bit about something that we haven't talked about on video, and that is your headaches. Yeah, your headaches. The headaches that occur here, the headaches that occur behind your eyes, headaches you may have in your jaw, even neck pain. Because as we know, our muscles of our necks are connected to the muscles of our head. Now, I know what you're saying. Some of you are saying, well, I have sinus headaches. Oh, really? Do you have a sinusitis? Do you have an infection? You see, the sinus headaches, we call things sinus headaches when we feel them here. And we feel them here because that's where our sinuses are. But the sinuses are only an airspace. And unless that airspace is filled with pus, expanding that area so you have a sinus infection, the things that we call a sinus headache are usually anything but a sinus headache. In fact, the headaches that we have are almost always muscular headaches. I want to show you something for a second. And Courtney, can you see this right here? So good. And what you're seeing here is a picture of a person, of a skull with muscles. And you see these little X's right here. This is the sternocleidomastoid muscle. Now, it's not really important what the muscle is called. The fact is that this muscle attaches our head to our neck. It helps us actually turn our heads from right to left. You see where these X's are? This is an area called a trigger point. Now, trigger points were very well described by a doctor named Dr. Janet Travell in about 1948. Dr. Travell was John F. Kennedy's doctor, as a matter of fact. And those of you who know Kennedy history know that he had tremendous neck and back problems. He had a lot of difficulty. So what Dr. Travell did was to trace trigger points and where those trigger points would cause problems. So you see where these X's are? That's the trigger point. Now, do you see where the blue area is? The blue area around the eye? That's what the trigger point affects. So in other words, if you have a trigger point in your neck, you're going to have pain in and around your eye. You can see other trigger points as you look down the screen, and all of the blue areas are the areas where you'll feel pain. So, and it's not unusual, by the way, for us to have sore necks. You see, when we have sore necks, then of course it can cause pain in other parts of the head and in the face, and particularly behind the eyes. So this is important. And I'm going to discuss a little bit more with you about the importance of this. You see, all of these muscles, the muscles of the neck, the muscles of the face, and the teeth, all connect with one particular area which occupies the space right here. It's called the trigeminal nucleus. The trigeminal nucleus is made up of the trigeminal nerve, and that is the nerve that affects the motor function, meaning the muscles that allow you to do this and allow you to do that, as well as the sensory function, meaning the pain that you feel in both the head and the neck. Now, it isn't just the muscles of the head. It isn't just the muscles of the neck. It isn't just the nerves supplying those areas that include the trigeminal nucleus. Do you know what else supplies innervation to the trigeminal nucleus? The teeth. And so the teeth act as a sensory organ to tell the muscles of the jaw how to close. Now, I want you to try something right now. Just try to slowly close your mouth. Do you notice that the teeth don't meet together? For most of you who are watching this, you'll find that there's one tooth that touches, and then another tooth, and then another tooth, until they all come together. Now, for most people, that's normal. But if you're one of the 25% of people who have headaches, that puts more stress on your already stressed system. Think about it. You have muscles that are very, very sore. You now have head muscles that are very, very sore because they are being stressed. The teeth are the last area of stress. So the teeth are essentially there to meet so you can chew your food, sometimes grind your teeth, and that's no good. And as a result, those muscles have to do a lot more work. And the nerves that are supplying those muscles are getting a lot more energy. And that's pretty negative energy. So that if all of us have certain thresholds, you know, we have a certain threshold for loud noise. We have a certain threshold for conversations. We have a certain threshold for certain foods that we eat. We also have a certain threshold for pain. So if these nerves that are supplying the muscles and are supplying the teeth, if the threshold is here, and then you go past the threshold and you feel pain, if you have more and more and more and more innervation to the face, to the head, to the neck, and to the teeth that's being stressed, you pass something we call the pain threshold. And you feel pain. You feel head pain and neck pain. We're very much into, and I've been doing this for years, treating headaches. Because headaches are involved with all of the muscles of the face, the head, the neck, and the teeth. And through a system which allows us to relax and reduce that pain threshold, we can treat 95% of some of the most severe headaches. There have been some marvelous advances in headache theory and also in headache treatment. Computerized analysis so we can see whether the forces on your teeth are balanced and whether they're where they should be. Whether the forces are imbalanced on the left side or on the right side or front or back. Studies that we can do on computer to see whether your muscles are working and if they're working properly. And if we find that they are not working properly, there are some therapies we can do to get them working properly again. And the most severe headache patient can have complete or nearly complete relief of headaches. So I know, you know me as a periodontist. You know me as somebody who does a lot of dental implants, and we do that. But if you're having facial pain, head pain, neck pain, what you're considering to be not migraines or sinus headaches, likely it's something we can help you with. So just give us a call. And if you have more questions about that, I have a little free report, a white paper that I've done, which describes how your headaches come about, where they come from. I'll be happy to send that out to you. Just give us a call and we'll be happy to send that.